I want to make one point in terms of possible solutions, and this was something that was driven home for me when I brought our first child in to get his vaccines. At that point, I was lucky to have tied my shoes that morning. I hadn't slept, I hadn't shaved, my fly was probably down. I was uniquely poorly disposed at that point to take in information about vaccines. Anything made me anxious. If they said, you have 20 minutes left on the meter, when you're working on 2 hours sleep, that's going to make you anxious. So I think one thing that could be interesting is moving the initiation of the vaccine discussion to prenatal visits. When my wife and I went into prenatal visits, we had a notebook and a list of questions, and then we would go home and talk about all the answers. Yeah. That was probably the last conversation we had about healthcare after our child was born. And that was a time in which we could take in information. And another issue I think we run into by not initiating that conversation in a healthcare setting until after the child is born is that parent has already been primed. Yeah. There are very few parents who get through their pregnancy and their birth without someone bringing up at some point the issue of vaccines. Right. So to the extent that the public health community, the medical community can be the people who are priming it, I think that could be really helpful. I also, because it's so difficult to address concerns within a wellness appointment, I think some pediatric offices, if they're big enough, could hold office hours, like once a month or twice a month. You don't need to make an appointment. You can come in and there'll be people from the practice there. Or having one person in a practice that's a designated vaccine expert. So instead of every pediatrician and every nurse practitioner feeling like, I need to be up on all of the crazy conspiracy theories that have popped up today, you can have one person, and if a parent says, I'm concerned about this, you can say, okay, well, I'm going to put you in touch with our vaccine expert.